All right. Great, thank you. And I assume someone will tell me if somehow I'm not sharing the screen. My assumption is that you're looking at my slide that says step 3. So let me know if that's not the case. Okay. So quick check-in. Let's just brainstorm. What are the kinds of charts and plots that you know? Like I showed you a bunch today, but I'm curious, like what do you know or use? Like somebody mentioned a bee swarm, which I think I kind of know what it is, but I don't totally know what it is. Like how can we name a bunch of kinds of charts or plots? Bar charts are life. All right. Staking, drawing a line in the sand right there. We're all about bar charts, huh? All right. Anybody use anything else? They do a lot of work, bar charts. Forest plots, lollipop graphs, time series, scatter plots, heat maps. Okay. Lollipop and charts, box and whisker plots. Great. Choropleth maps. Wonderful. Maybe controversial, but I like, I don't know what STA is. Maybe it didn't quite get finished there. Stacked bar, gotcha. There are definitely times when stacked bars do the job. Pie chart. Heat maps. All right. Donut charts. Cool. That's great. So we're not going to talk, we're going to maybe almost talk about all those. Not quite all of those, but almost all of them, which is great. Okay, I'm going to delete these. Get back to my cursor. So here's the task cognitively that we have. We have data which sit in big tables of numbers and text, and they're hard to wrap your head around. And so we want to represent data in some sort of visually compelling way. So I think a natural question to ask is, how do our brains work? How is it that we cognitively process pictures and interpret numbers? How do we understand that? Well, not surprisingly, turns out somebody researches this. So kind of the classic work in this is by Cleveland and McGill from 1984. And maybe you can tell it's 1984 because their examples are sort of old school looking. But amazingly, they tell us about most of the most modern visualizations. And here's what they did. They took the same sets of data, different data sets summarized in different ways, and they represented them in a variety of different visual forms. And then they gave them to people and they asked them to interpret the result. And they gave them to a lot of people and asked them to interpret the results. And they basically created a rank order of, on average, how humans, although honestly, my guess, it was probably done in a very specific subset of humans, probably in a university environment and probably in the US, I'm not sure. So whether it is actually all humans who process information this way, but let's go with that for now. How humans can understand or conceive of values and relationships from pictures. So what is it that gives meaning? And what we have here are 9 types of visualizations they used in this list. And the top 3, the ones for which when the data are represented this way, people are most consistently able to correctly interpret what the graph is saying, what the picture is saying. Those are the top 3. And it's called position on an aligned scale, position on a non-aligned scale, and length. Now that sounds kind of abstract, but these translate to specific plots that we use. So position on an aligned scale, that means you have dots or symbols that are along a constant scale that you can directly compare with one another. So a dot plot and a scatter plot are examples of that. That's the one that cognitively people are best able to correctly identify relationships between numbers. Second to that was position on a non-aligned scale. That sounds a little confusing. It basically just means 2 side-by-side dot plots. So they're not all in the same graph space, but they have the same scale. They have the same range of the scale. So it's two side-by-side plots. And third is length. So lots of love for bar charts, and if you like to flip them the other way, column charts. It's funny, I sometimes thought that the thing that I'm getting from a bar chart is maybe actually communicated by area, like how big it is, but of course that's wrong because you could make a bar chart all kinds of widths. Or by its position on the scale, but really the thing that a bar chart does is it tells us length. So the length of the bar is what communicates the information. So we could communicate that information by putting a symbol or a point where the tip of the bar is, or by having a bar that goes from the bottom up. Now this becomes important. I'm going to talk a little bit later about some of the controversial things that we should and shouldn't do in visualization. And one of them is a statement that some people would make, which is that your y-axis always has to start at 0. And I would say that is definitely true for a bar chart. I'll come back to my hesitancy to say that is true universally later. But it's true for a bar chart because length is where the information is. And so if you were to cut off its length, then you're changing the story. Okay, so those are the top 3. What are the other options? Here are 3 less good representations. In other words, when people saw data represented with these kinds of symbols, they misinterpreted the results. So slope and angle. At first I was like, what do we ever do with slope and angle? But it turns out the way that we read pie charts is by looking at the angle in the middle. That's what the wedge is, what tells us how much information is. And we're not that good at it, turns out. Now a donut plot is like a pie chart with the middle taken out. I just told you that the way you read a pie chart is by looking at the wedge. Well, we just took the wedge out. And so with a donut plot, you've actually got only an extrapolation of the angle, which is the part that still exists. And then you're actually trying to gauge the information by curvature, which makes it challenging. Now, bubble plots, I'm actually a fan of bubble plots, but people are bad at interpreting them. And because the information is conveyed by area, how big the bubble is. And we're just not very good at gauging, is that bubble a lot bigger than that other one or just a little bit bigger? What does it mean? So we're not very good at gauging area. And then volume is towards the bottom. This is why, if I think many people have probably heard this, don't use the 3D features in Excel and other software like 3D pie charts and 3D bar charts. What those 3D charts do, they look kind of nifty, but they basically begin to symbolize volume because the chart has not only area, but it has a depth to it too. And we're terrible at visualizing and understanding volume. So we make all sorts of misconstrued assumptions. So I will say never about any chart type. There's a time and a place for everything. But when I say, as we go along, that things like dot plots or slope graphs are great and things like pie charts are not, it goes back to this basic research about how our minds, how our brains cognitively process information in a graphical form and convert it into some sort of a numerical relationship. Because at the end of the day, that's what we want. If we don't get people to see the relationship that's there accurately, then we haven't succeeded in our visualization. All right, now we're going to dive into a lot of charts. We're not actually going to talk about all of them. You'll be glad to know. And you may recall in the morning session, I gave the overview that was from the that free ebook, that electronic book that's online that I gave you a link to. All those images were from there. In that book, the author categorized all of the plots by the relationship to the statistical summary. Like, is this a quantity? Is this a XY relationship? But I'm actually using Stephanie Evergreen's strategy because she frames the way to categorize plots more as the kinds of stories we want to tell. So choose this plot if you're telling this kind of story. And I like that strategy. I don't think it's inconsistent with the other approach of dividing it by distributions and amounts, etc. Okay, so our first one that we're going to talk about is the simplest, and I think a very powerful one. When can a single number tell the story? So what is the take-home message? Remember, we got to this point choosing a chart, choosing a visualization, because we already thought about what our message is. So what if the message is 700 women die each year in the US as a result of pregnancy or delivery complications, or 65,000 women experience life-threatening complications, or 83% of maternal deaths do not occur on the day of delivery, right? So those are single numbers which communicate a lot, and they can be represented clearly, and we can convey important information to stakeholders about what's happening. So I just have other examples here. What are the COVID-19 deaths in your state, or the prevalence of breastfeeding at discharge, or the rural-urban disparity? So for each visualization, I'm going to have a slide like this that are just examples of like, what's the story we can tell? What would be the one sentence, so what, for each graph? 700 women die of pregnancy-related causes each year. Your chances of dying from a snake bite are 1 in 50 million, or only 27% of children in this county had a dental visit in the last year. What's true about each one of those is it just took one number to say the thing. We could show that number in a lot of ways. For example, here's from a variety of different visualizations that I found. You could just use a large font. So this is from a infographic on Native health. So in the Navajo Nation, 1 in 3 residents do not have access to electricity, and 1 in 3 do not have access to running water, right? You tell a clear story in those visualizations. You can also report a number through something like, this is sometimes called a waffle plot because of the grid, or it's also called an icon or picture array, where you represent the total population or the total number of people at risk in one color, and then you show the number of people that you're focusing on. 1 in 30 youth, ages 13 to 17, experience some form of unaccompanied homelessness over the course of a year, right? So we can see kind of this relative importance of this number. Now, on the right-hand side are 2 that I made. I mentioned a donut plot before. I said it's like a pie chart with the middle eaten out. So it looks like donut. Donut plots by themselves, as I said, are hard to interpret, and it's because of what Cleveland identified. The information we have to go on is the extrapolation of the wedge from these lines and the curvature, the amount of the circumference of the circle that is pink versus orange, right? So basically, we're working hard to come up with this. All I could tell you for sure by looking at the donut plot is that more than half is orange, but I couldn't come anywhere near a number. But if we use the donut plot just as graphical eye candy to wrap around the number, it can sort of emphasize the point. So that's what I've done here. The donut plot actually is representing 63%, but just to be sure everybody gets it, I put 63% and a really big number in the middle. So that's one option. Now, this is a column chart. You might say, why are we using column charts when you just said we're highlighting a single number? But actually, we can use a lot of conventional charts and use color to highlight a single number. So here, I've just made a plot of very low birth weight per 100 live births, and they're stratified by region, census region of the country. So Midwest, Northeast, South, West. And what I did is I wanted to tell the story of the prevalence of very low birth weight in the South. So I'm providing context to my one number, which is 1.5%. I'm providing context by showing these other regions, and you can see that the South has the highest prevalence of very low birth weight. And I'm using color to make this one stand out. So we can do that in a number of different plot types. All right, so that was a nice, simple approach, right? We started off with, we just got one number. That's all we got to talk about. And I I wouldn't shy away from the wide range of utility that that one option gives you, just reporting one number. But inevitably, there's going to be a time when you have two numbers and you would like to talk about them both together, right? So this is the story about how two numbers are alike or how two numbers are different. So when you have that scenario, in other words, what I'm trying to emphasize here is you're making a comparison between numbers, right? So we compare values and numbers a lot. Again, the reason for our love of bar charts is they're a really handy way to compare values. So examples would be a pre versus post evaluation of a program, or comparing the means or frequencies between groups, any number of things. So this is from a CDC infographic. The pregnancy-related mortality rate for Black women with at least a college degree was 5 times as high as white women with a similar education, right? So it's basically talking about the racial disparity among women with, well, now here I copied that from the website. Now I've got to actually think about what it is I'm saying. So PRMR for at least a college degree. So some college or greater versus white women with a similar education, right? So it is comparing the white and the dark purple bars in each case. So we can see visually that, remember what are bar plots telling us? They communicate, they encode data through length. So we can see that the length of the bar is substantially longer for Black women as compared for white women in both of the some college and college graduate or higher. All right, so comparing two numbers. What are the stories that we can tell when we're comparing two numbers? Things like outcomes were better after the program than before, or obesity prevalence was higher in children in rural as compared to urban schools. Or maybe vaccination rates decreased in 2020 versus 2019 in 5 out of 8 health districts. Okay, so this one was a little more complicated, right? The two things that are getting compared are 2020 versus 2019, but I'm doing it separately in 8 different health districts, and of 5 of them, there was a decrease in vaccination rates. So comparing two numbers. All right, now you've already, professed your love for bar charts. So we can do lots of things with bar charts. One thing we can do is grouped bar charts. They look different depending on the software you're doing. So this is in R, and I could tweak this more to make the space different. But in this case, we're grouping by year, which is to say I've put all of the region data, this is now infant mortality rate data together for 2007 and together for 2018. I'm showing region. And so what I'm able to do is say, how are regions different in 2007 and how are they different in 2018? So it's good for between region comparison. It's not very good for between year comparison. Here's one of the challenges of bar charts. We're not great at comparing across multiple lines. So if you have a complicated bar chart where you got lots in the group, so I might want to know, well, how much bigger is the green, which is the Northeast, in 2007 as compared to 2018? And I could draw some lines across, but it's not as easy as it is to tell the within region comparison. Well, you might say, I've got a good solution. Let's group them differently. So how you choose to group bars totally can change the feel. So here I'm grouping by region, which is to say a group has both a 2007 year and a 2018 year, and I've got a group for each region. So now what I can easily see is the reduction within region. So how have rates changed over time within region? But still maybe takes a little work to know, I wonder if the reduction was bigger in the West than in the Midwest. It's a little hard for me to know because I'm sort of trying to measure that length with my eye to know. So bar charts definitely can do a lot of work, and the way you choose to group them if you're comparing numbers is important. It is, though, difficult to compare these non-adjacent bars, and again, it's because bar charts rely on length to represent values. Now, this is called a slope graph. It's basically like a dot plot, which is to say I took every number and I made a dot from it, and then I connected the pairs of dots for the 2007 year and the 2018 year within each region. So this kind of graph actually is characterized as that highest in Cleveland's hierarchy. It is positioned on an aligned scale. So what that means is the location of these points along this scale tells us value. And so we can, without measuring length, we can easily see kind of the distance between these points. And so we can say that the South and the Midwest in 2007 had about the same absolute difference as the Northeast and the West. And this is a little less. And we can also see that they're very close together in 2018. And the connecting line actually borrows from another of Cleveland's cues, which is angle or direction. And we're not great, but pretty good at distinguishing when a direction, when a slope is steeper or not. So what this does, what a slope graph does, is tells us within each year we can see the regional difference, and between years we can see the difference in slopes. So it's easier to see both within year differences by region and region differences over time. Now, I know I'm not going to convince you to go out and change every one of your bar graphs to slope graphs, and I think that probably wouldn't be helpful. But for those super diehard bar graph fans, think at least sometimes of when a different kind of visualization maybe gets the point across more readily. Now, you could, I don't have this here, but you could do the same thing here that I did with the example with all the gray bars, and I had one blue region highlighted. So if I was trying to highlight the rate of change in the Northeast, for example, I could make all the rest of these gray. I would have to label them somehow so I know which is which, and then just have the Northeast as green, and then it would pop out that it was the one that I was making the message. The story is about change in the Northeast, and the other information is about context. So slope graph. All right, there's, if you want to read more about people who are, I'm not super against bar charts, but if you want to read some people who are super against bar charts, check out this blog post called Killing the Bar Chart. So this is from an economist. I mean, there's a point at which any chart ceases to be useful. And when you start to put so many different things on it, it's probably, you can't expect it to stand up to anything, right? So this chart becomes cumbersome to look at because there's paired bars, right? So we've got the Gini of, Gini is the income inequality measure of income before taxes and transfers and after. So there must have been some kind of a policy intervention that changed taxes and transfers, and they're looking to see whether the income inequality changed before versus after. So whether the income inequality got smaller. So we've got it for the United States and then for Israel and lots of countries, right? So there's a lot of information. They also thought they wanted to put the actual data values on there, which is a good idea. It ends up with a lot of clutter, okay? So there's a lot going on. That's why he's killing this particular bar chart. All right, so what this blog post does is try to say, well, how could we make it better? So the first thing they did was just took the arithmetic difference. So 0.57 minus 0.42 or 0.58 minus 0.41. That must not be what it is. It must be the ratio because that number doesn't look right. They took some calculation, the gap between the Gini before and the after. And basically what that did is it took out half the bars, right? Because you no longer needed the pair, you just needed to know the difference. This must be a ratio. So that helps a little bit. But then they used something called a dumbbell dot plot. So a before versus after. What a dumbbell, so you can see why it's called a dumbbell, right? It's got, for every country, we've got a before and an after, and it's connected by a line segment. And so it looks a little bit like a weight, like a dumbbell. But what this does is it lets us see easily, they've sorted it from highest to lowest at baseline. So the countries are ordered by who had the highest income inequality at the beginning to the lowest. And then for each one, you can see how far they changed before versus after. You can see it both by the position of the orange dots and the length of the segment that connects them. All right, so Whether you like this or not, I don't know. I think this is pretty effective. I think it gets at the idea. They did one more thing. They said, well, what if we definitely wanted the values in there? So they just replaced the dots themselves with values. So you get the same visual information. You kind of get this feeling of the highest to the lowest and the distance between them, but you also give the reader the exact number so that they don't have to do any guessing. So I think these dumbbell dot plots could be, particularly when you've got this paired data, could be a useful alternative to paired bar plots. Now, if you have, only 4 pairs of things, it may not be a big deal. It may be that your bar plot is perfectly legible. So I'm not going to make you stop. All right. So we talked about a kind of approach where we chose a single number to tell a story, a kind of approach where we compared 2 numbers to tell a story. What if we want to compare to a benchmark? So a benchmark might be context, like the infant mortality rate in state X as compared to the US average overall, or it might be a goal, like infant mortality in 2010 compared to or in reference to Healthy People 2020 target. So that's what we have in this plot, which is again from CDC. This is race-specific infant mortality rates. And what they've done is they've just put in the target line so that you can see how different groups are doing in relation to the target. Not only are they there yet, but is anybody approaching the target? Are they going in the right direction? So benchmarks, I think in public health, we may use this pretty often, right? Thinking about how do we visualize something in relation to a goal. So the stories that we can tell with benchmarks. We met the target program enrollment in 4 out of 5 districts, right? So we could have a bar plot or another kind of plot that had 5 points and 4 out of 5 of them are beyond the target benchmark. So that would be an easy way to communicate that. Or we are approaching but have not yet met the Healthy People 2020 target. Or rural counties have lower than average number of OBGYNs taking new patients. So that's comparing rural counties to an average in the state in terms of how many OBs were taking new patients. So benchmarks could be useful, and they're pretty simple. They're just basically taking graphs you already have and just giving some reference that usually involves a visual, like a line, and then some text that defines what that line is. So here is just adding benchmarks to a slope graph or to a bar chart. In this case, I'm adding it, so the Healthy People 2030 target is 5 deaths per 1,000. And this is, so basically nobody was there in 2007, but it looks like on average, the Northeast and the West are below the 2030 target in 2018. And then here's the same information portrayed in a bar chart. Now, a bullet plot is kind of a newer visualization, but it is very much connected to this idea of benchmark. It's a little bit more complex and it takes some work. So this is one that would be very audience dependent. Either you need an audience who can relatively quickly grasp what's going on, or you're going to need to provide a lot of additional information, but a lot of additional sort of training or contextualization. But once you get people up to speed, it can communicate a fair bit of information. So it takes more work and contains more information. There's actually 2 comparisons going on. So here's just an example. In this case, these are percentiles that go to 100%, so it can't be higher than 100%. And in this top example, there's something that, at least in the observed data, is going from 0 to 300. Okay, so there's just some top end. So the light gray just is showing the furthest it can be. The dark bar in the middle is your data. So that's like a regular bar chart. So your data is the dark bar. The red lines are the target. So that in the case of this top one, there's a single target. In the case of this bottom one, there's a different target for each performance indicator. And so you can see for each indicator whether the actual value has not met or has met and exceeded the target. Okay, so that's the same that we got from the benchmark from before. But what also is included are, So we can think of these as quantitative benchmarks, right? So this is the quantitative value you have met or not, you're up to that point. But we can also use qualitative encoding by using shades of color. So in this case, it's a grayscale, but it could be colored as well, where perhaps this darkest color is you're really not anywhere close, the middle color is you're getting there, and the top color is you're doing really well. So in that way, it's sort of making two kinds of reference, one to the absolute threshold of the benchmark, and two to the sort of relative qualitative idea of whether you're in the bottom 25%, the middle 50%, or the top 25%. So a bullet plot could be worth investigating for some questions or some visualizations. All right, I suspect that many of you work with Likert scale data. So that is to say, you either implement surveys or you analyze the data from surveys where people can answer something on that sort of strongly disagree to strongly agree type of scale. What's unique about Likert scale is that the neutral value is in the middle. And that means we don't necessarily want to start people at 0, because 0 is actually really bad. Kind of the neutral place is in the middle. So we want to think about how can we represent these Likert values. Now, I said earlier, sometimes we just summarize them, like we take the average of them. We count them as 1, 2, 3, 4, 5, and we say the average response was 4.2. So I teach in a university environment, and that's how my course evaluations show up. Students respond on a Likert scale, and I see a 4 point whatever, right? So that is a possibility. But if you wanted to actually show the whole distribution, we should recognize that the Likert values were discrete. They aren't continuous. So taking a mean is not exactly what was intended, or it's not exactly how they work. They're discrete values. People chose a category. And so maybe showing how many people are in each category is more informative than saying what's the mean value. Okay, so that's what this is about. Now, here's an example. Well, actually, I think I'm going to talk about this example more in just a moment. All right, so what are the stories we can tell with Likert scale data? Respondents said option A was the most favorable. All right, so that's pretty easy. Most patients reported good or very good experiences with home visitation. 25% of women were unsatisfied with the contraceptive options available postpartum, right? So we can summarize not only kind of that take-home message, but also be able to visually provide the information about the people who are not in the take-home. So we're providing all the context. Here are 4 ways of visualizing Likert scale data. All right, so this is actually from another blog, and the example is everyone likes chocolate, but Bounty and Snickers get the most extreme opinions. I don't even know what Bounty is. I don't know. You guys know what Bounty is? I know what Snickers are. I think I know what all of those are, except for Maltese teasers. I don't know what that is either. So one option is you can do stacked bar charts. Now, somebody said earlier, it's controversial, but I really like stacked bar charts. Now, when stacked bar charts don't sum to 100, they can be challenging because it's hard to compare the middle values of the stack. But when they sum to 100, the total length of the bar is the same for everybody. What's changing is what the color is of the proportion of the bar. So in the case of the Likerts, it's 24% here, 36%, 15, 11. And so I couldn't tell you for sure, just visually, whether, for example, this one, Galaxy Caramel, was bigger or smaller than this one, Maltese Teasers, except that they put the number in, so that way I can. But just from the length, I couldn't say that for sure. But I definitely, for the one that's left justified, I can easily see which is the longer, and the one that's right justified. Okay, so that's an option, a 1 to 100% stacked bar chart. This works especially well when you put the numbers in, because it obviates that problem of I can't quite compare the length of this to the length of that. But if you give me the number, I've got something to work with. All right, we could also do diverging bar charts. So the one that was on the previous slide was a diverging bar chart. And what that means is instead of left justifying the bars, what if we lined up the middle of the neutral value? So we're going to line up these. This is how many people were neutral on each one. And that way we can see to one side how many people had positive feelings, and on the other side, how many people had negative. Like clearly we've got a lot of strong negatives for the bounty. That's very apparent here. We've also got more neutrality about, let's see, which one is this here? This is Milky Way? Milky Way, yeah, a lot of neutral feelings about Milky Way. I have some pretty neutral feelings about Milky Way. Okay, so that's another option. Visualizing Likert scale data with neutral split. That means that we're aligning at the neutral point. Some people feel like the neutral is different. I want to take them out and I only want to talk about people who have strong opinions. So another option is this one on the right, diverging bars with neutrals separate. So this is a situation where we're actually taking the neutrals and putting them as their own bar chart to the right, and then doing an aligned with the negative feelings going to the left of the line and the positive feelings going to the right. And then finally, this is something called small multiples. I think we'll talk a little bit more about small multiples. We can do, oh good, somebody told me it's British candy bars and coconut dark chocolate. Oh, that sounds good. All right, maybe I would like it. Small multiples means that we actually make a separate plot for each one and we put them side by side and they have the same horizontal scale, like the same width and range, so that we can easily kind of compare them. We can see that the extreme values are smaller. We've got a lot of sentiment in the I like them. And then we can see the range of the I like them a lot, etc. So these are all options. And, honestly, I think it depends on your situation. But what it means is you can take Likert scale data and summarize it in a way that people could kind of get like, okay, yeah, people really don't like that. Or yeah, mostly they're on board with that. Okay. It's also possible, although questionable perhaps, to summarize Likert scale data with other means. So a pie chart in particular, I would say, is questionable. The reason it's possible is because if pie charts were to make sense in any situation, it should be something when they're representing the parts of a whole, right? They're showing fractions that should add up to 100%. And that's what we've got in a Likert data. So we can see kind of the range of people who have strongly disagree, neutral, agree, and strongly agree. And this is obviously not about candy anymore. This is now about perceptions of naloxone. We could also show the information in a bar graph. So what's maybe more challenging about this is these bars all sum to 100 because everybody's in one of the bars, but it's not obvious that they sum to 100 because they're next to each other. So it's a little less clear. Now I'm going to talk about color later, but I just want to pause and point out that this is probably not an optimal color approach for these plots. And I don't know if you have sense of why, but the reason is because neutral is given a kind of dark color and neutral should probably be a light color. And we want to distinguish the two extremes. So what we're not really able to do here is separate visually the extreme disagree and the extreme agree because they're all in a continuous color. So when we talk about color, this will be a situation where a divergent rather than a sequential color ramp would make more sense, but we'll come to that. And then in this particular case with the naloxone, the author ultimately decided on a diverging line. So in this case, they actually aligned it at the left hand, instead of aligning it in the center of the neutrals, they aligned it on the left-hand side of the neutrals, but nonetheless able, oh no, maybe they aligned it on the right-hand side of the neutrals, my mistake. These are the neutrals here. Okay, so again, perhaps a better way to represent the data, certainly than pies and probably than bars too. All right, now one that I like a lot, just because it sounds good, I like chocolate and lollipops, I guess. I like visualizing groups in rank order, thinking about a lollipop chart. Now, a lollipop chart, again, is like a dot plot with segments. So going back to Cleveland et al., we're using 2 cues to tell the reader what's going on. The first cue is that we've emphasized the point itself. And remember, what we're best at interpreting is the location of points along an aligned scale. But in addition, we've also got these line segments, which are a lot like bar plots. So they're telling us length as well. So we've got both length and points along an aligned scale. And what that does is it gives us a lot of easy to interpret information, not only about the rank order, but also about the relative gaps between, for example, New York and Washington here. Now, what I'm doing in this particular plot is an example of what we've already talked about, which is in addition to using the lollipop chart, which is just simply showing the value of each state's infant mortality, I'm highlighting the state I live in, Georgia, to demonstrate that Georgia has the 7th highest infant mortality rate in the US in 2018. And I'm doing that by emphasizing it with color, but still reporting the values for all of the other states. They're listed here. And this works particularly well when I sort the states from lowest to highest or highest to lowest. So visualizing groups in rank order can be useful. Here's some stories that we might tell with rank order data. Things like our state is doing better than most, or these hospitals are performing worse on valid completion of vital statistics forms, or the most commonly described barriers to postpartum care is scheduling around childcare, right? So we could imagine a number of graphs where in this bottom example, you might have a lollipop chart where you had 8 or 10 self-reported barriers to care, and they're put in order by their prevalence. And so the most common in this hypothetical example is scheduling around childcare. So lollipops for rank ordered data when the rank is really important, when the ordering is really important. All right, how are we doing? I'm going to stop for a minute. Any questions? All right. You're all phased out from your lunch, or you're thinking about British candy bars. Tyra, yes.
Please excuse my AC unit if it's rambling in the background. I was going to ask, which charts do you think for the general population, thinking about health equity in communities that may have low literacy, right? Like some of these are very, very fancy and cool, but just, I know we talked about it depends on your audience, but I just wanted to get your feedback on working with community stakeholders.
Yeah, no, I think that's a great question. And we'll talk about that just a little bit more later, but actually not a ton. I mean, it really is, I think what's going to be the answer to many questions is you should be intentional about the choice of plot for the setting you're in. And so just the fact that you're asking the question and thinking about it is exactly the direction you want to be going. Like, you should be asking, is this a good way to visualize data for this particular audience? I think lots of infographics use just single numbers or just, 2 paired bar plots or, relatively simple things. And they add a lot of cues in as well, like have the visual and the data value, like the number itself, or the visual, the data value, and a sentence that interprets it. So using all of those things, I think, in all sorts of communities, numerical literacy and data literacy are challenging. I think that we're used to seeing lots of kinds of things and also not always critical users of them. So we need to be careful how we represent information. So I think, this is probably not something that would need to go to a community group, because probably you're not looking at rank order with a community group. Maybe like-it responses are, but it could be something like the slope graph, I think is pretty easy to interpret. Whose infant mortality rate went down and when, right? Or possibly some bar graphs. And certainly like just the single number summaries, I think are really good. And that's why they're used quite often on infographics, because they're meant to be public facing. So that's a great question with a pretty wishy-washy answer. And the reason is because it depends a lot. But asking the question, thinking about it, being intentional is definitely the way for us to do a better job. Thanks. Any other questions? All right. Now we're talking about a more complicated idea when we start having two variables and we're talking about how the change in one correlates with the change in another. This really probably is not a public facing kind of visualization, but is a super common visualization for research or for internal use, or stakeholders that are comfortable with data literacy, because there is a lot of important information when we start looking at relationships, when we start looking at scatter plots. So this is one that can tell us a lot, and also it can pack a lot of information in a way that might not always be intuitive. So the question is, how does this thing change when that thing changes? So in this particular example that I've got here, the country-specific life expectancy declines as its infant mortality increases. So in other words, this is dots representing lots of different countries, and as their infant mortality rate goes up, their disability-adjusted life expectancy goes down. Now, the first thing we should always remind ourselves and other people whenever we show unadjusted scatter plots is that correlation is not causation. So we don't know that infant mortality is causing this. We don't know if something else is causing both of these. There's all sorts of things going on. Nonetheless, it's a really important kind of idea to get at, which is the relationship between continuous values. So the stories that we can tell when we're looking at correlated change in two variables. The simple one is each time this changes, that does too, right? That's basically what we're saying when we do a correlation or a linear regression or something like that. Or when children have a healthy breakfast, their test scores go up. Or these hospitals are outliers and are worth investigating further. That would be an example where maybe everybody's along the line and these particular hospitals are outside of the cloud of dots. And so we're interested in why are they performing differently. So we can tell a lot of stories with correlated change in variables. So XY plots, the convention, so this is good to know and also cautious to interpret, is that the independent variable or the predictor, the thing that you might call the exposure, is on the x-axis, and that the dependent or outcome variable is on the y-axis. Now, in many settings, you're looking at the correlation of two variables and maybe you're not sure which way it goes. Or if correlation is not causation, maybe it doesn't go either way. Maybe there's something else going on. So you want to be cautious about that. But if you're thinking about what goes on which plot, that's sort of a conventional way people look at it. As X increases, I might expect Y to do something. And so I'm starting with X and then looking at Y. Also note that we generally do not connect the dots on a scatter plot unless the dots represent something that is naturally ordered, like time. And I think that I have an example of that coming up. So in this XY plot, the line is like a line of correlation or a regression line, but we wouldn't connect these dots together. Whereas in other plots we did. And here actually is an example where we do. So this is the infant mortality rate by race in the 20th century. So although the value is measured for each year, in other words, it's aggregated up and reported as a single number per year, it is customary to connect the dots between years because we know time to be continuous. The intervals between years is equal. So we're just representing these points together. We're sort of smoothing that information. So the interpretation here is that infant mortality rates declined for Black and white infants, and maybe also that racial disparities in infant mortality rates have persisted for 120 years. So we could tell a couple stories from this, and we'll actually revisit this plot a little later. So stories of change over time. Things changed, or sometimes good and sometimes not. Things didn't change, right? We did a lot of stuff and it didn't get any better. There's change after introduction of the program. Postpartum visit attendance has declined since COVID-19. Hispanics have improved their health profile more than any other group in the last 2 years, right? So we can tell different stories by using data that's captured at different time points and talking about that change over time. Now, I spend a lot of time with geospatial data. I actually teach a whole class in spatial epidemiology. I'm only going to give just a tiny snippet. I know that many of you said you're interested in mapping or you're doing mapping. Obviously, mapping is just an explicitly visual approach to data. It's a way that we put data, and in this case, public health data, in a particular kind of context that we can't use with any other chart. And that's, we put it in a geographic context. So we're not saying this is where this age people are or anything like that. We're saying this is where they are, like on the ground. And in doing that, we can encode complicated information like where do rates vary over space? Are they higher in some places than in others? And in particular, are there clusters or patterns in the highs and the lows? So these maps are called choropleth maps. So here's some stories we can tell with geospatial data. Infant mortality varies substantially across our state, or maternal healthcare deserts are clustered in rural low-income counties, or child obesity prevalence is greater in neighborhoods with more social vulnerability. So lots of interesting things that can be particularly well displayed with maps. Just as an example, a sort of silly example, this is a map of the infant mortality rate in the US in 2013. So it's obviously not a very interesting map, but I do it to say that there's this correlation up to a point between what we can put in a visual map and what we might put in a table. So in the table, the infant mortality rate in 2013 was 6 for 1,000. And so I mapped it. Well, you might say it's not very interesting to see that. We would like to disaggregate data. Disaggregating data is interesting for all of epidemiology, and it's really important when we're talking about health equity. How are we masking patterns when we aggregate people together? So disaggregating means breaking people up into groups so that we can see variation. So we could make a table, like I have on the right, that is disaggregated infant mortality by state. And what we're doing is ranking it from the highest to the lowest. So this list goes much further down, but you can see Mississippi has the highest infant mortality rate. Now, if I were to take the idea of the table and make it a map, it would look like this thing on the left. I've ranked the states from highest to lowest. See, they're darker colors, which means higher, to lighter colors, which means lower. Obviously, that's not very useful. It's not useful until we put those two things together. We use color to show the highs and the lows, and we use their actual geographic location, sort of putting the puzzle together so that we can see patterns. And when we do this, we can see something that would not be readily apparent from a map, from a table, and that's that there's a cluster of high rate counties near each other in the deep south, and that there's low rate counties on the coasts and in part of the Midwest. Now, if you knew where every state was and you looked through the table, you could come to that conclusion too, but this tells it without much work at all. So that's, to me, the power of maps, is that they tell a particular kind of story. Not every story is a geographic story. So we don't use maps for everything, but I use them for a lot. All right, I think maybe this is the last one. I mentioned earlier the idea of small multiples. This is not actually a new kind of graph, it's a new way of making a graph. Small multiples means make one graph, except make a bunch of them and put a different data subset on each one. It's a way to be able to reduce the clutter in one graph space and be able to see some of the range. So what this is from a project I did a number of years ago, where we used a longitudinal data set of where women lived during pregnancy to measure their neighborhood deprivation. And what we wanted to know was their life course trajectory in terms of neighborhood. In other words, were they always in the same neighborhoods that had high deprivation? Were they always in the same neighborhoods that had low? Or were women upwardly mobile or downwardly mobile over the course of their life course? And this was one of our early steps. Each one of these small multiples is a graph of a single woman over her life course. Age is on the x-axis, and her neighborhood deprivation is here. 0 means an average neighborhood, greater than 0 means there's high deprivation, less than 0 means there's low. So this first woman started at age 20 in a neighborhood with higher than average deprivation, but then over the course of follow-ups, ended in a much lower deprivation neighborhood. In contrast, this woman had kind of the opposite experience. She had a transition from a low deprivation neighborhood to a high deprivation neighborhood. So here's the key thing about small multiples is it lets us take complex data. Like if I were to try and plot all of these women's lines on top of each other, it would just be a jumble. Takes complex data and it lets us see them all with consistent axes and scales so that I can easily see across. So we could imagine doing this if you had a data series that had an X and a Y, it could be dot plots, it could be bar plots, it could be pie charts, it could be many things. We could do a separate one for every county, or a separate one for every age category, or a separate one for every race ethnicity. So small multiples are a powerful way to deal with complex data. This is probably also not a public facing kind of plot. This is a more cognitively challenging plot, but also very powerful. This is an example of a small multiple that a colleague of mine at CDC made. I was a contributor to the paper, but he was definitely the genius in the map itself. And this is a very cognitively challenging visualization, but it packs a lot of information. So first of all, for every year and for every age group, he calculated county-specific change, year-over-year change in heart disease mortality rate. And then he color-coded them. This is the axis down here. And then he arranged these small multiples so that the columns are age categories and the rows are the year of death. What that means is that the diagonal are actually birth cohorts. So if you're familiar with the demographic term age period cohort, this is an age period cohort map of change in heart disease mortality. Now, that's a lot to take in, but I just included to say small multiples are a really interesting way to incorporate complexity and help walk people through it. All right. I think let's go a few more minutes and then we're going to take a break. All right. So I told you about a lot of plots I like, and maybe I inferred that I didn't like some as much, but I want to know what you think. In the beginning, you told me what plots you do like. What plots do you not like? What are your, I don't really like to look at that. I don't want to make that. I don't think that works. All right, pie charts, stacked bars. Got some love of not loving pie charts. 3D bar charts with 3/4 perspective. Oh yeah. All right. I think we're on a theme here. Too much heat maps. Okay. Yeah. All right, super. I'm going to delete these and I'm going to do just a couple more minutes and we'll take a little break. All right. I'm with you if you don't like 3D bar plots. So this is an example. Paper doll charts. I'm going to show you a good paper doll chart in a minute. This is an example of a 3D bar plot of the passengers on the Titanic. So tell me, can you guess how many first-class passengers there are from this graph, or how many third-class passengers? You can put it on or you can just think about it. All right, I'm actually gonna delete drawing and I'm gonna move to the next one. There are 322 first-class passengers and 711. I took out the, there are 322 first class and 711 third class. However, if I were to look at first class, I would have guessed that there's under 300, and I would have guessed that there's under 700 third class. But in fact, neither of those is true. So my ability to sort of take this plot, project it against that line, and follow it back over to the axis completely failed me. And it has to do with a perspective thing of where this bar is and where the vantage point is. So because we can see the tops of the bars, we're actually looking down on them. And so we can see stuff that's behind them that we shouldn't be able to see. This is just, it serves no purpose. This is a terrible plot. We could tell the very same information far more transparently and clearly by just making these simple bars like this. Okay, so my message there was, I said never say never. I can't think of a good reason to use a 3D plot. Well, if you were plotting molecular structure, where 3D is what it is, that would make sense. Okay, that's the one I can think of. All right, pie charts, about 703rd class. All right, good. You may know John Tukey. He invented a couple of statistics. So like somewhere deep in the bowels of your statistical software, you can choose to have a Tukey test or something like that. That's John Tukey. He has this pithy quote: "There's no data that can be displayed better that can be displayed in a pie chart that cannot be displayed better in some other type of chart." So he's not exactly saying that the pie chart is a fail. He's just saying it doesn't excel at anything. It's mediocre at its very best. Use the annotate. Mark with like the stamp the largest slice in each of these pies. Tell me which slice. There's one slice that's bigger than the others in each of these three. Tell me where. Okay. All right, so it looks like we've got a lot of E, C, and B, but some variation around as well. All right, I'm going to show you what it is. Hold on, I'm just going to, actually, if I leave those, will we be able to tell where they were? Not really. Okay, I'm going to clear drawings. So in the first one, it was E. I think that's what most people got. In the second one, it's C, but it's pretty hard to tell. It's not very much at all. And in the third one, it's A, which I think most people said B. So again, what's going on here is that the visual and cognitive clue that we have is a clue about angle. It's our ability to sort of gauge the number of degrees of the angle of each slice, which is, you know, even when we were in geometry and we were taking it with little protractors, it was maybe sometimes hard to do. And just doing it on the fly, we're not so good at. Clearly, it just isn't hard to tell at all that there's an upward trend in this first one, there's a downward trend in this other one, and they look kind of like a mix in this middle one. That's a far easier story to tell than the pie chart. So I liked this. The only good pie chart is the chart of the pie I've eaten and the pie I've not yet eaten. So I'm not totally against pie charts. I think there's a time for them. And one example that I mentioned earlier is when you have things that sum to 100%, like Likert responses, and there's not too many categories, then it is possible to use a pie chart. And at least you can get a qualitative feel for like, yeah, most of the people said that. But it's very difficult to get a precise quantitative feel from a pie chart. To do that, you have to put numbers on, and then maybe there was a different chart you should have used. So that's my take on it. All right, now I think it is time for us to take a break. So we made it through step 3, which was visualization. So just as a recap, we talked about a lot of them, and you don't have to remember them all. All of these things are available. You can find out about them in lots of places. I'm going to give you some resources. The key is that you choose a visualization based on what came before. What type of data? What's the story? What's the source of data that's going into it? So when we do those things, we can come out with a reasonably good way to convey the message. So that's where we're at. The next thing we're going to talk about is the actual design, some of the tips and challenges when it comes to designing the actual output itself. So let's take a, if we could, do you think we can just take a 5-minute break instead of a 10-minute break? So I have 307. It could be 207 for you or 107, but let's come back at 312. I know that's pretty random, but I'm going to just put, oh, no, okay. Now we just, so 313. Turn in 5 minutes at 313, 213, etc. Okay, see you soon. Oh, Tyra, do you have a question?
No, sorry, I need to lower my hand.
Okay. Okay. I know that was a short break. Excuse me. And maybe not everybody's back yet. So I was so good at the time this morning. I thought I had it all down, and I'm taking too long this afternoon. I just get so excited about my chart types, and I can't stop chattering on. So here's what I'm going to do. We're going to move through this section, and I want to get to the last piece, which is thinking about these steps through the health equity lens. And then we'll get wrapped up on time, I think. So our step 4 is how to actually make something that works. And when I say works, I mean it achieves your goal. It communicates your message, right? So what do we need to do that? Because picking the chart wasn't enough. Now, you don't have to know all of this, but I think it's kind of cool that people have thought about what makes a graphic a graphic. And actually, it's a series of layers of information. And so we're going to think about these layers of information. Some people call this the grammar of graphics. And the layers are things like we have geometric objects, right? So points or squares or lines. And we put them inside of scales and coordinate systems. So scales means like what are the things on this axis and what is on this axis. Coordinate systems has to do with how these are related to each other. Is this a log scale or is one categorical, etc. And then really importantly, there's plot annotations. So that's titles and footnotes and other text. What this means is if we think of the finished plot as really a layered set of entities, then we can pay attention to each layer one at a time. So we're going to try and do that. So design. For thinking about designing a visualization, we have a lot of tools at hand, and color and symbology are incredibly important. So we can use the shape and size, and especially the color, to encode all kinds of information about the magnitude of a value, the membership in a group, the relationship between things. So color and symbols need to be selected very intentionally. We want them to achieve their goal, and their goal should be to tell the story and not to get in the way. All right, so don't choose lots of colors because they're pretty. Maybe what you need is a bunch of gray with the one data point highlighted, for example. Here's just from a data guideline from a UK foundation. And these things I thought were not incorrect. I don't think they're totally the only thing to go with, but I think they made some good points. Get it right in black and white. So make sure your design works in a grayscale before adding in color. Don't assume that colors will signal meaning when used on their own. So that is a way of forcing you to be intentional about color. The safest hue is blue. One of the challenges with color is a fair number of people are colorblind, and there's a lot of kinds of color blindness. And so if you choose a color that people can't see, they're not going to tell the difference. So the richest color across all types of color blindness is blue. So blue is often a good color choice. Red and green should never be seen. And that's again about color blindness. They're more typically or commonly colors that are not seen with color blindness. All right. Now, in terms of color, I used this word earlier, a color palette. So a palette means not just a single color, but what are the set of colors that go together? Because I just don't have much artistic sense. If I just pick colors out of the blue, it would just be an ugly mess. So luckily, lots of smart people have come up with sort of pre-designed palettes that are known to work well. And this website down here, colorbrewer.org, is a great place. If you do any mapping, you've probably been there before, because the way it's set up is primarily illustrated with choropleth maps, but the color palettes at Color Brewer can be used in anything. You can use Color Brewer for bar charts or dot plots or things like that. So there's three kinds of palettes when you're choosing color. Well, actually, one option is you don't vary color. Say a bar chart, all the bars should be blue perhaps because you're not trying to distinguish between them. So maybe they're just all one color. So that's maybe the starting point. But if you're going to have color, think about it according to the way that the color relates to the number. So a sequential color palette typically goes from a light color to a dark color in even steps. And so what that's doing is it's communicating something about the intensity, value, or magnitude of a number. And cognitively, we know this from studying how people interpret color. People tend to think that the darker colors are carrying higher values, lighter colors are carrying lower values. So we just naturally see value range, numeric value range when we see color like that. So it works great if that's what you have. Say a rate, it goes from a small number to a large number. Now a diverging color palette is one where the neutral color, instead of being light at the bottom, the neutral color is in the middle, and the extreme values diverge in both directions. And we can highlight that by having darker hues of two different colors going out. So a light red, then dark red, and a light blue, then dark blue. So these diverging palettes are good when you have something that maybe is centered in the middle and can go in either way. So Likert scales is one thing, but also rate ratios and rate differences that have a null value and could potentially have values in either direction. Sometimes people use diverging palettes to highlight, if they would say, here's the average in the US, and those that are purple, for example, are higher than average and green are lower than average. So sometimes that happens. And then finally, something we use a lot in visualization is qualitative palettes. This is intentionally not ordered. So when you have race or ethnic categories or gender categories or other categorical variables that are not ordered, don't use colors that seem sequential, because that implies that there's a natural hierarchical ordering to those groups when there's not. Now, if you want to choose color, you can, as I said, go to Color Brewer. You can click on any of them, and you actually can highlight which palettes are colorblind safe or print friendly or photocopy safe, and it'll filter for you. And if you don't have those color palettes in your software, you actually can manually force them by copying either this hex code, or you can change this to RGB code. So if you work with color at all, that may be familiar. So that's just to say the Color Brewer website gives you the ability to import those palettes. So how do we use color? We can use color to distinguish categories. So this is a plot of all of the states sorted in order of population growth from 2000 to 2010. So we can see that Nevada had the greatest positive growth and Michigan actually had some population loss. But color is then used to highlight the region. And so what we can see with the color is it appears that almost all the population growth was in the West and the South, and the smallest population growth and the one place that had population shrinkage was in the Northeast and the Midwest. So color in this way helps distinguish categories in this otherwise rank ordered chart. We can use color to represent data values. So the choropleth map is a good classic example of that. The way a choropleth map works is the color represents a continuous numerical value. In this case, this is the infant mortality rate due to congenital heart disease mapped at the county scale. And they actually chose a divergent ramp, which means that the neutral color is whatever the average rate is. And the red are counties that have higher than average infant mortality due to congenital heart disease, and the blue is lower than average. So color to represent values, data values. And then colors to highlight. So I've already shown both of these examples, but these are times when the story I want to tell is about the South or about Georgia in these two examples. But I provide this other information because it's important context, because it lets you know where, if I just told you 1.5%, who knows what that means? Is that good? Is that bad? But what we can see is it's worse than all the other regions. So we can use color to highlight a story or a message. Okay, coordinate systems. So remember, we had the geometric part, which is how do we put things on? Coordinate systems are like the axes and how we're organizing them. So putting data in an intentional order that logically tells a story. You notice that some of the plots I've shown today have had their axes ordered, like from high to low or low to high, and some have not. It's not required that they be ordered, but it probably is a good idea that whatever you do, you did it on purpose. So maybe it's sorted from low to high, or maybe you have one group that you're interested in and you put them first. Maybe you put it in alphabetical order, but you should think about it and make a decision. Another thing in coordinate systems that many of the plots have shown is to de-emphasize grid lines, like all the lines all across that are there by default. They're important. They do help our eye sort of follow along, but they're not the most important. They should be in the background, not the foreground. So we can make them gray or make them transparent so that they're not too powerful. Any ideas? What is the problem with this graph? What's wrong with this graph? I think people may have it, but I'm going to actually move on while you are thinking it. Color no labels, or color no labels is true. This is an issue though of the axis. It didn't start at 0. So the graph I showed you is the one on the bottom. It's a bar chart and it started at 15. So what I said before, yeah, no labels is right. That's definitely an important one because we have no idea what, we don't know what we're mapping here. Remember, a bar chart, the way a bar chart works is length encodes information. When you cut out the length, then it's not encoding the right information. So a bar chart needs to start at 0. So somebody might say, should a y-axis always start at 0? And maybe we would say, absolutely yes. Bar charts use length to communicate information. So yes, they should. This is a kind of funny example. I think somebody said they didn't like paper doll charts, which I think is what this means. This is an average female height by country. Now, we just were talking about starting the axis, so you might already see the problem. What I loved about this is it came with a lot of great Twitter information. As an Indian woman, I can confirm that too much of my time is spent hiding behind a rock, praying the terrifying gang of international giant ladies and their Latvian general don't find me. right? So we've got the Indian woman's average height here, and then the Latvian woman, and then these others. This person says, my wife is 4'10", and today I learned that she doesn't exist. Latvian woman be like this. So obviously there's a problem with this plot, and it's that this literally put their feet at like 4'9" or 4'8" or something like that. Like, or no, not even that, 4'10" maybe. So this is a good example of why a bar chart starts at 0, because length, height, is the thing that's encoding information. All right, but are there times when maybe we violate that rule that the y-axis should start at 0? And I would say, yeah, there are times. Bar charts use length. They have to have 0 involved. But other plots use positional information on the axis. And so points and lines can communicate information that requires the reader to look over at the axis and not look at its length. And in that way, in some circumstances, it might be useful to not include 0. So what would be those circumstances? What if 0 is not a plausible number? Why would you start your graph at 0 if there's no chance that we'll have 0 mortality, right? That just isn't one of the things that's going to happen. So maybe 0 isn't a meaningful number, so it shouldn't start there. Or, and this is often the case when we're doing surveillance of perinatal outcomes, small changes year over year tell us a lot. And if we forced ourselves to always use 0, we might actually mask interesting changes because of the scale of the map, of the figure. So in this case, this is a CDC product. You can see they use this double hash mark to just say, yeah, everything from like 750 down is collapsed into here. So they're zooming in on the mortality rate. This is a mortality rate overall at the higher end. So I think the starting point should be your y-axis should be at 0. That should be your default. But I would not say that you can't change away from the default in some circumstances. All right, that's all I'll say about that. Annotations. We can put all kinds of text on plots, and some text helps so much, and too much text is a big clutter. So how do you find the balance? All right. Titles and subtitles can do a lot of work. I'm going to show you in a little bit some examples of titles really changing the way you see a graph. But a title should be short, and it should tell the reader the so what. 6 to 12 words, say. If you need additional information, you can put it in a subtitle. A subtitle simply means that it's a smaller font. Axis labels. Try to keep text horizontal. You know how sometimes you make a bar plot and they all get mushed together, and one of the options you can do is like rotate it 45 degrees or even turn it 90 degrees. Turning it 90 degrees makes it much harder to read. 45 degrees maybe. You might try rotating the whole graph and making it, instead of a column chart, a bar plot that comes out from left to right so that you have more space, or otherwise figuring out how to alter the labels so that you don't have to rotate them if possible. Labels can do more work than legends. So we're really used to having a legend that tells what everything's for, but if you can actually put text on the plot that tells what the colors are or what the values are, then you've made it so that the reader doesn't have to even look at the legend. Now, the legend should probably still be there, but you've made it much easier. Now, that obviously can go too far, but think about how you can put annotation onto the plot, like labeling the series or labeling the categories directly on the plot, so that the reader doesn't even need to look. All right. So this is a summary of what we've talked about basically since lunchtime. Our step 0, it all starts with good data. If you don't have good data and good questions and appropriate caution, then all bets are off. When it comes to the story, it's about your audience, it's about your message, and it's about your output. Are you making a visualization, an infographic? Like what level of complexity can you manage? The type of data matters. So think about whether you have just numbers or categories or one of these epidemiologic parameters that has some extra cause for concern. When it comes to choosing the chart, lots and lots of options. There's not there's not one right answer for everything. There's usually a few answers that would work, but there probably are some less good answers, maybe even wrong answers in some circumstances. And then color, symbols, axes, labels, all that little fussy stuff that you have to do at the end, it could be the make or break that makes your visualization work. It's the stuff that gives just the right amount of clues to what's going on. All right, so we have about 30 minutes left, and I want to just see if there's any questions before I transition to the last piece of the day. You know, I kind of rushed through that last little bit there, but. I've just lost my screen of view, so I can't see if you're raising a hand. So just holler out if you do have something. And now I'm going to share. Okay. So this is our final piece. How do we bring this all together? Health equity, data, and visualization. So I want to just remind us of the steps that I introduced this morning when we're putting these steps together and thinking about health equity. The health equity part of being a good epidemiologist is things like checking our assumptions and thinking about who is in versus out of the data, and thinking about whether measured categories are actually capturing something like lived experience. In other words, are the way that we capture data reflecting something about the experience of people? So those are the things that are step 0 relevant. But when it comes to the story, I think a starting point is first do no harm. So thinking about whose worldview is being represented in the way that you share data and who will benefit from the story. So if we think about those two together, I'm sort of asking about who controls knowledge. Who decides what is the right way to go and not? So the answers that we're visualizing, the things that we're producing, are a function of what was collected, maybe by us, maybe by other people. Maybe the decisions were made outside of our control, maybe they weren't. And the questions that were asked, like what are the things that we think are compelling? Again, maybe we decided those questions, or maybe they were imposed on us by needs for a particular program evaluation or something. So I want to just touch on concerns with measure and categorization of social experience and this idea of who's asking questions. And I would say that one solution is better collaboration and consultation. So that means making sure that program people and epi people and policy people and communications people inside your agency are talking together, but also thinking about how we can get engagement, collaboration in an authentic way with stakeholders, with communities, to drive what are the important questions to help interpret the results. When we're thinking about the categories, so say race, ethnicity, the categories that often we're constrained to, because that's how the forms are created by often not us, thinking about, can we disaggregate race or ethnic groups? In other words, are we lumping people in ways that are inappropriate? Or possibly are we splitting people in ways that aren't meaningful? So thinking about that idea of what does it mean to have a shared experience? Who should be in what group? And getting input into questions and interpretation. So one challenge, this comes from a couple papers in sociology that have been critical of social epidemiology. And they're critical of the way that a lot of health disparities, I put kind of in quotes, health disparities research, social determinants of health research, has inadvertently caused some harm. And so one of the things that happens is we know that when we're thinking of health equity, we're thinking of gender and sexual orientation and race and ethnicity and cultural and ethnic group membership. Those are socially constructed population groups. By socially constructed, I mean that they didn't just exist from the beginning of time and are built into our DNA. They're things that human beings created, not always by consensus, created over time. And they're important because the creation of them is associated with people's experience in positive and negative ways. So identity is important, and also the access and opportunities to resources. So we've got this social construction that drives a lot of our health equity work, right? We're interested in monitoring health disparities, say, and then we measure health disparities. And the question is, what's happening in the black box? And in particular, when we frame the story that we're telling, are we accidentally or inadvertently making the black box look like what happened in here is these people made bad choices? Or alternatively, are we emphasizing or highlighting or looking for evidence that it's not actually about individual behaviors or individual choices, but that it's a function of systemic or structural processes? So when we are not, when we're agnostic about what happens between definition of the group and the measurement of the disparity, when we aren't actively seeking what's happening in the black box, we may inadvertently be reifying the social construction itself. So this paper by Shim was just an interesting example that kind of evaluated and critiqued how the use of race, socioeconomic status, and sex in epidemiology has become routinized in a way that seemed technocratic and seemed devoid of sort of a theoretical conception of what those entities, what those concepts even mean. So that's just one thing to think about, right? That we can inadvertently be telling something that maybe we didn't mean to. This is another paper. It's called Known to be Unhealthy, and it really looked at the development of the concept of low socioeconomic status in social epidemiology in Europe, and the ways that that research and then policy reaction to research maybe caused harm. So there were three sort of things that were patterns across many epi papers. One was this tendency to treat low SES as a single group. So to generalize findings, you studied a small group of people and you assume that it's the same experience for everybody who's low socioeconomic status. And so that maybe leads to policy efforts that aim to change individuals' behaviors in ways that may not make sense for them, because maybe it lacks additional context about the variation among those people. Another was that low socioeconomic status comes to be referred to as an inherently unhealthy population. So findings that health is worse is generalized to poor health for all, rather than, so it's a tendency to see social class purely from a deprivation standpoint and not from a resilience standpoint, for example. And then a third was a tendency, in some papers at least, for low SES to be framed by the way the authors talked about it as essentially a deviant personality characteristics. Like these people are resistant to participation in the program, or they're resistant to education about good behaviors. So identifying something about the individual as the explanation for the black box, rather than whatever social relationships gave rise to that. Okay, I see a comment here. Sorry if it came in a little bit a while ago. What's the solution on data visualization when people dealing with data lump categories together? Oh, so I think I'm going to tell you something about that almost right this second. I actually don't have a great solution, but here's a paper that one of my students did where he basically was interested in perinatal outcomes among Asian Pacific Islanders, which is the category, the racial category on the birth certificate, that actually includes a hugely heterogeneous group of people. Now, as you may know, on the birth certificate, there's also country of origin. And so what he did, he was interested in the relationship between economic segregation in a place and preterm birth. And so this is a disaggregation of Asian Pacific Islander subgroups and looking at the relationship between, this is segregation on the x-axis and probability of preterm birth on the y. And what you see is that there's kind of a null relationship for many groups, but for Filipinos and Samoans, maybe a little bit for Koreans, there's a different relationship where increased segregation is associated with increased risk. There's a lot to be said about that. The differences between these groups are about differences of culture and language, but also differences of the history of colonization. So Western powers have colonized the world in many ways, and those have all sorts of impacts. And so the history of who was colonized when, and the relationship that we have with respect to migration, whether they migrated as refugees, asylum seekers, or possibly highly educated competitive skills visas, means that there's differences among these groups. So the answer to your question is, how do we deal with that when we maybe don't have enough data to disaggregate? That's a challenge. But I think the idea of trying to disaggregate aggregate is important. This is also true of Hispanics, which of course aggregate lots of different groups of people together, people who both culturally may have differences, but also come to be in this country through different histories and paths, including some who were here way longer than we white people were. Okay, so disaggregation is important. It does raise challenges with data capture and numbers, but I think when possible, it's worth examining. All right, so we said first, do no harm. Think about the story. We had all those sort of challenging things about how do we frame the message? Are we, in fact, inadvertently perpetuating a problem rather than helping uncover the source of it? So that was step one. The step two, so here's what I'm gonna do. In the interest of time, I'm gonna tell a short story in step two, but I'm gonna actually buzz through it kind of quick because it's not core to what you need to know, and I wanna move along. But the story has to do with the fact that math communicates values. So when we're thinking about how numbers tell something to people, it's not just that the numbers tell them an objective thing, it's the value that we apply to it. So let me first tell this story, which again, I'm going to tell in a kind of compressed way, and then I want to give you a few examples from a nice paper. So the story starts off with infant mortality in the US. So as you see here, this was an MMWR from 1999, right at the end of the 20th century. CDC put out an MMWR, was sort of like the top 10 greatest public health hits. And one of them was that since 1900, infant mortality had decreased 90%, which is pretty amazing, right? So this is the infant mortality. We were just talking a little bit about categorization. So you probably know that racial categories, they're not static, they change over time. We identify different groups of, we name people and lump and split them in different ways at different points. So the reason this graph says white and non-white is because that's how the data were captured, I think maybe before 1920 or something. For the most part, these are births to African-American women, but it's a category that's it's not fixed in truth, it's a social construct. So what we can see from this is that infant mortality went down for everybody. And when we look at the reasons why, there are things like clean water and adequate nutrition, vaccine and infection control, improved medical technology, safe labor, et cetera. Now, if I take those exact same data and I plot them here, and by the way, I am violating one of my rules. I said earlier that we should not have two y-axes. I have two y-axes. This is a messy, this is a disaster, but I'm doing it for a purpose. I'm going to tell you about it. The yellow line is the disparity if we measure it as a rate difference. In other words, the rate in Black babies minus the rate in white babies. And it started really high and it went down and it looks really low. And then the purple line is the disparity if we measured it as a ratio, which is often what we do. We say the Black-white disparity in infant mortality is about 2. Well, what's surprising to me is that although the yellow line, it looks like the disparity is nearly gone, right? Like it's really low. The purple line, basically there's been this same disparity for almost 100 years, right? So it's hardly changed at all, which seems, I mean, just numerically, that seems crazy that any relationship like that could stay for so long. So it brings us to the question of what is the story of these data? Now, again, that plot is a complicated one because I've got the two axes going on, et cetera. But there's two stories going on there. The racial disparities in infant mortality are consistently shrinking over time. That's the story from the rate differences. Or Racial disparities in infant mortality have been virtually unchanged for 100 years. That's not very satisfying when there's two opposing messages. So what's going on? And it has to do with how we think about the process that gave rise to infant mortality and the things that we're valuing. So this is the part where I'm going a little fast. Let me orient you to this, and then we're going to move right along. I have time on the x-axis. On the y-axis, I'm still talking about infant mortality, but I'm not talking about the rate. Now I'm talking about the rate ratio. So remember I said there was a rate difference and a rate ratio. I'm only talking about the rate ratio now, and I'll come to why. So this is the black-white rate ratio of infant mortality starting in 1920. And this particular line is not all infant mortality, it's specifically infant mortality from gastrointestinal disease. So look at this. It goes from basically a very small disparity relatively. So Black and white infants had relatively similar risk of death from gastrointestinal disease, diarrhea, early in the century. But then it shoots up so that the Black-white gap is almost sevenfold in 1960, and then it seems to decline. So what explains that? Well, one thing is in that time, municipalities began establishing more sophisticated sewer and clean water treatment plants. But not surprisingly, if you know about the history of a lot of development, the earliest neighborhoods, the early adopters of this intervention were usually high-income white neighborhoods. And immigrant neighborhoods, communities of color, low-income neighborhoods got services later. So essentially, the reason this disparity shoots up is because infant mortality from gastrointestinal disease declined among white babies while it stayed the same among Black babies. And so the relative gap just shot up, it got really high. But once there's sort of the catch up and what, everybody's got access to water treatment, then we see the disparity coming down again. All right, here's another cause of death. This is death attributable to preterm birth. A very similar pattern, starts low, goes up, but it's a little offset. Well, that actually aligns with about the timing of the dissemination of these highly technological medical interventions called NICUs. And what NICUs did is they helped little tiny babies survive when they used to die, right? They helped the little tiny ones that just wouldn't have had a chance can survive in a NICU. In the beginning, NICUs were not available everywhere, right? They were available in cities, they were available at private hospitals. At this point, they're available to many people, but a similar pattern where as NICUs became available, the early adopters, or the people with early access, were people with access to these resources like elite academic institutions or private hospitals. And so their mortality from being a little tiny baby went down while the mortality for Black babies didn't, and that resulted in this increase and then a decrease. And then the final one is SIDS. This is a very similar story. The pattern's not quite so strong, and we see something like the increase in the disparity occurring in reference to the initial American Academy of Pediatrics sleeping recommendations for back to sleep. And as you may know, those early recommendations had some issues with whether they were culturally appropriate and language appropriate. And so they were probably adopted and accepted and available to people who were educated and perhaps white earlier than to other people. And so once again, we see this pattern. All right, Manal, I'm going to come back to your question in just a little bit. So this is where we ended up with the story. Our feeling is that the pattern that we're seeing is one of what Lincoln Felon called fundamental causes. There's a fundamental structural difference in the access or the opportunity to engage with new emerging resources, so new technologies. So when there's a new prevention effort like clean water, or a medical effort like NICUs, or an educational knowledge effort like back to sleep, those things are not disseminated evenly, they diffuse unevenly. And so that may give rise to these disparities. And for that reason, the ratio scale makes more sense to tell that particular story, because the ratio scale normalizes for the background decline in all groups and says, what's the relative gap? Okay, maybe that worked for you, maybe it didn't, I'm not sure. So what I'm going to do now is say that there are several ways that disparity measures can give you different answers. And I'm not going to be able to tell you about all of them, but what I want to do is sort of list the ideas, and then you can look at this paper later if you'd like to. So the example I just gave you was, should we use a relative or an absolute scale? And the answer is, it depends on exactly what it is you're trying to tell, what pattern you're going for. And it's not uncommon when you have rates that are declining that the two answers will be different from one another. So just like the infant mortality, this is a scenario where the rate difference is going down over time. That's because the rates are going down. The rate difference is just the numerical gap between them. And so if they're both going down, the gap's got to get smaller. But the ratio doesn't necessarily. So a ratio may be particularly good when you're looking at trends over time, but with a background decline in rates. On the other hand, a difference is useful because it captures the absolute burden. So this is an example from some work on community drivers of maternal mortality. And we actually chose the absolute scale in this case. And the reason is because the black-white gap in maternal mortality is so huge that you could have something that didn't look like a strong ratio for Black women because their baseline was so high. The best off Black women had a rate that was so high that to have, say, a doubling among Black women was to make it exorbitantly high. So in fact, as we were looking at community drivers of maternal mortality, the neighborhood deprivation index was one indicator, and it looked like, using the ratio scale, that it was more important for white women. It increased the risk. Each 1 unit increase in neighborhood deprivation increased her risk of pregnancy mortality 23%, but for Black women, somewhat less. But when we looked at the absolute scale, the actual burden of how many additional deaths would occur for each increase in neighborhood deprivation was substantially larger for Black women. And that's because the baseline rate was high. So again, the choice depends on the context. And we could inadvertently have said, oh, it looks like NDI is not that important for Black women, when in fact it's incredibly important. Okay, so I keep reevaluating my time because I'm just watching the clock tick. So I'm actually not going to tell you these next several things. What I am going to tell you is you should go read this paper right here, Implicit Value Judgments in the Measurement of Health Inequalities. It is really great because it identifies a few other ways that measures of health disparities give us a one or the other perspective. In other words, you could have this impact in this way or this impact in this way. So choosing between them matters. And so choosing intentionally is important. Okay, so having said that, now I'm going to skip through a bunch of slides. So the last things in this final minutes, I want to come around to this idea of, okay, right. So remember where we just were. We were just here. What type of data do you have? And I was emphasizing this idea of the kind of data we have, whether the kind of story we're telling may influence the way we represent the data, because a relative plot versus an absolute plot would tell different stories. So we choose a chart, but now we've got this final stuff, and especially for outward or public facing visualizations, it's really important that the way we frame the visualization through the title and the annotations and the legend, again, tells a story that reflects people's lived experience and doesn't inadvertently cause harm. So some examples. Language and text and titles matters. So there's lots of encouragement now to use people first language. So for example, people with disabilities rather than disabled people. From the Urban Institute, there's this guide, which is one of the additional resources that you have on the conference website. It's called Do No Harm, Apply Equity Awareness and Data Visualization. So it's a whole guide specifically about equity and data visualization and things to do and not do. This is the link, but again, the guide itself is on the conference webpage. So label people, not skin color, was another recommendation. These are from that guide, and I thought that they're interesting to think about what we're saying when we choose a title. So I'm going to show these two and then one more plot on the next, and the data are all identical. What's different is the title. So as they suggested, titles do a lot of work. So on the left, mental health in jail, rate of mental health diagnosis of inmates. So that's the title and subtitle. On the right, racism in jail, people of color less likely to get mental health diagnosis. So it's changing the frame of what you're about to see and also identifying more explicitly what the inequality is. And this one is even a different way of putting it. And it's an alternative to the sort of deprivation framing, and it's identifying people who are benefiting from a system, even in jail. So racism in jail, white people get more mental health diagnoses. So different ways that titles can frame what you're showing. Now, obviously, depending on where you work, you may have some constraints on exactly what you can put in titles, but what we put in titles definitely has a huge influence on how people view the result. We talked already about ordering labels and axes intentionally. So putting maybe the focus group first or the largest effect first. When you're thinking about color choice, avoid colors that reinforce gender or racial stereotypes, like probably no reason to use pink and blue for gender. Sometimes people try to use colors in their bar charts that associate with skin tone, which may or may not come off very well. And definitely avoid the sequential palettes when talking about race ethnicity, because there's no natural order from low to high. And that's what's implied when you use a palette like that. Many people using infographics also use icons and shapes. You want to be aware of that, like that you're not using stereotypes in your icons and shapes that might be harmful, and thinking about avoiding images that show individuals as helpless victims if the problem that's being communicated is something about social or structural determinants of health. I just showed this. This is a CDC plot. And it maybe contradicts something I just said, and I don't know, we won't have much discussion of it, but you can contemplate whether it works or not. What it contradicts is it seems like the Hispanic, Asian Pacific Islander, and white groups kind of are in a common color palette, even though they're distinct groups, they're not ordered. And then American Indian, Alaska Native, and Black are in another color palette. So it sort of seems like they are putting them in sort of a rank order. But I think also they're doing two things that maybe are working. One is that they're highlighting the groups with the highest disparity with the purple, and that the color intensity may be showing the range of rates from high to low. So I don't know how I feel about this. I'm not totally sure that it's wrong, and I suspect they thought a lot about it, but I just pointed out. Okay. I had a little activity we were going to do, and we're not going to do it because I want us to stop. And I want to say that you did an amazing job if you're still awake, because boy, did we just cover a lot of stuff. We've got a few minutes for questions. Let me just see. Change headlines to get clicks, titles matter. Yep. Okay, so Monal, when you don't have large data set with large number for these racial groups, how do you represent data? I think you're maybe talking about the aggregated piece. So this is probably a different thing from visualization. It's a super important thing. And it's like, you know, our common tension is how do we deal with the most precise data, which is to say numerically accurate, and also the most disaggregated, the most granular data. And those two things are at odds with one another. It happens when we're mapping data, happens in population groups. So, you know, there are some things you can do, maybe like if PRAMS chooses to oversample certain strata, right? The reason they do that is to make sure they have an adequate number of groups they care about. So maybe PRAMS needs to think about oversampling groups that you're interested in. Obviously, that's a hard row to hoe because there's a lot of there's a lot of demand for how samples go. So increasing data, pooling data over multiple years sometimes works. Those aren't great solutions though. Yeah, and programmatic data, right? You may just have limited number of options. Any other questions? So how about this? We're at 4, and I don't want to make anybody stay longer than they want to. I am happy to stay. I want to just remind you one more time that there are a lot of resources that are under the presentations tab on the conference website for this workshop, including all the slide decks, but also some really great checklists. There's both the general data visualization checklist, but also one from the Do No Harm Urban Institute report. Downloading those, keeping them somewhere, using them as a guide. And then, as I said, there's also a document I put together with links to other resources that I would encourage you to explore. Because really, if you're going to do this, you're going to just have to do it. You know, you sit in one of these things and you get ideas, but then you just need to go do more of it. So good luck with that. I'll stay and chat as long as anybody wants to, but I can say we're done. Thank you all.
Thank you, Dr. Kramer.